Good day, I'm George Calixterio. I'm on my first year of nursing in Edith Cowan University, Banbury campus. In this presentation, I will discuss communication as a hazard, nursing profession in Australian context. I will also give an overview on the National Safety and Quality Health Services Standards, as well as the contribution of nurses in a healthcare system, specifically on identifying hazards, safety and quality, medication safety, and healthcare outcomes. Communication plays an important role within the healthcare settings. It becomes a hazard when there is a communication breakdown, there's a lack of information and miscommunication. Example, a medication error happens when healthcare workers are not on the same page and don't communicate effectively. Therefore, nurses should conduct risk assessments, training and education, and report findings to eliminate hazards for patient safety. Nurses are infection warriors. They are considered as one of the frontliners during pandemic. They contribute and work tirelessly to have infection preventions and control programs as well as outbreak management in place, such as conducting vaccinations and immunizations. They observe hand hygiene and they use protective personal equipment at all times. These are all for safety of the patients. Nursing is the largest regulated profession in Australia, comprises of 40% of the healthcare system. Nurses could be an enrolled, registered, or nurse practitioner. Their roles vary depending on their classification based on their educational level. In Australia, nurses to practice their profession need to be registered with the Regulatory Nursing Board known as AFRA. Nurses help navigate Australia's healthcare system. Their compassionate approaches, clinical skills, and commitment as an advocate of patients' well-being is commendable. Their adherence to clinical governance, building therapeutic relationship with consumers, strong comprehensive care, observance of effective communication, medication competencies, and a spot-on skill in preventing and controlling infections, as well as responding to acute deterioration, is an indication of their adherence to the National Safety and Quality Health Services Standards. The medication competences of nurses is their greatest contribution to medication safety. Their impeccable skill in recognizing drug interactions and side effects governs them to prescribe, disperse, and administer medicines safely to patients. Their thorough medication reconciliation is an assurance that patients receive correct and accurate treatment. Nurses' contribution to healthcare is an evidence of their evidence-based practices. Healthcare equity and patient advocacy is their main priority. They encourage their patients and their advocates to be involved in any medical decisions. They are very much hands-on in giving and assisting preventative care and primary care to achieve better healthcare outcomes. In conclusion, nurses are very essential members of the Australian healthcare system, providing vital care, support, and expertise across various settings. They promote health, prevent illnesses, and managing diseases, contributing significantly to improving patients' outcomes through direct patient care, service coordination, education, advocacy, and upholding safety standards, making them indispensable within the healthcare system. Here are the references in this presentation. Thank you.